Kimberly Cataudella, DNS, the news and observer. What is RSV, the common virus affecting many this fall and winter? Dr. David Weber, Associate Chief Medical Officer at UNC Medical Center and Medical Director of UNC's Department of Infection Prevention, tells us what to know about RSV's symptoms, recovery time, treatments and more. RSV stands for respiratory syncytial virus. It's a common virus that typically runs through the region from December to February. This year, the season began in October and was already starting to decline by the holidays. Anyone can catch and get sick from RSV, but it's particularly a problem in premature infants and older adults. Most who catch it will recover in about a week. The infection and death rate for RSV looks similar to the flu, so it is an illness to be taken seriously, Dr. Weber said. How can you catch RSV? RSV is a droplet-spread disease through environmental transmission. The virus thrives in lower temperatures with low humidity, our current wintertime environment. If you rub your nose then touch something in the house, then I touch that same spot and rub my nose, I have a high chance of picking up RSV, Dr. Weber said. RSV is most commonly spread through coughing and sneezing. People infected with RSV are typically contagious for 3 to 8 days. The virus can survive on surfaces for up to 6 hours, but household disinfectants can kill it. Practice good hygiene habits, including frequent hand washing and home sanitizing. What are the symptoms of RSV? The illness usually starts with symptoms of a common cold, said UNC Health pediatrician Dr. Ricardo Baler. This can include, it usually starts as a cold with a runny nose, nasal congestion and cough, and by day 3 or 4 the patient may have some wheezing and symptoms or signs of respiratory distress, Dr. Baler said in a UNC Health Talk blog post. They may not be able to eat because they're respiratory. How long does it take to recover from RSV? Should you see a doctor? Healthy children and adults will recover from RSV in about a week without needing prescription medication. Staying well hydrated is the most important step to recovery. Providers may recommend a breathing treatment with albuterol, which is administered via a nebulizer to get the medication into the lungs. About 2% of patients need to be admitted to the hospital for more intensive treatment, Dr. Baler said. UNC says to call your doctor immediately if your child has RSV symptoms and is there an RSV vaccine? There's currently no vaccine to prevent RSV. 2 companies are testing some vaccines right now that may be FDA-approved for older adults by mid-2023, Dr. Weber said. It'll take longer to get these approved for children. Though there isn't a vaccine, there are antibody treatments that are especially effective for young infants. Drive.